Good afternoon, folks. If you can hear me, I'm just going to give a moment to allow everyone to get connected here. Once I see everyone is on, okay. I believe we are all on the line now. And so thank you everyone for joining us this afternoon for this media briefing regarding the ongoing COVID-19 outbreak situation in the NWT. Just a quick note before we get started, if you aren't already, please mute your microphone until called upon. This goes for media as well as all participants. And this will help limit any potential feedback that may occur. Speaking at this afternoon's briefing will be Premier Carolyn Cochrane, Health and Social Services Minister Julie Green, Chief of Behchoko Clifford Daniels. We also have joining us Minister of Municipal and Community Affairs Shane Thompson, MLA for Monthui Jane Wyalan Armstrong, and Rebecca Nash from the Tlicho Community Services Agency. As per usual, following the remarks from our three speakers, I will open the floor to questions from media outlets. I will identify each media outlet and allow you to determine who will represent your media outlet and who would like to ask the question. Once you ask your question, please provide the name of the individual who your question is directed to. If you don't know, you can state that and we'll direct your question to the best person to answer it. With that, I'm going to turn it over to Premier Cochrane to deliver her remarks.
Thank you, Ellie. Thank you, everyone. Good afternoon, and I'm going to try to keep it brief today because I want media to be able to ask questions they have on the recent containment order. Behchoko. So yesterday we said that the Northwest Territories was at a pivotal moment in the pandemic, and we need to take swift action to do two things. One, protect the health and well-being of our communities, which is our top priority, and we need to protect the integrity of our healthcare system so people can continue to receive the care they need when they need it. Residents of Behchoko, I want you to know that the government of the Northwest Territories is doing everything we can to limit the number of cases of COVID-19 in the community as much as possible. We're working closely with the Tlicho leadership and the Tlicho Community Services Agency to ensure we take a coordinated effort as we work to contain the virus. If we've learned anything from past experiences in Fort Liard, Fort Good Hope, Norman Wells, and Coval Lake, it's that when we come together and support one another through tough, challenging times, that's when we make a difference. This time is no different. And while we're doing our part to limit the spread of the virus, we need all of you now to do yours. And now more than ever, stay home if you have symptoms. Do not gather with people who are outside your household. Wear a mask when in public. If you need to go to the healthcare center or the grocery store, and keep your distance. We have seen success with containment orders in the past, but it requires residents to do the right thing and what's best for the health and well-being of their community. So please follow the Chief Public Health Officer's orders. Lastly, get vaccinated. It's the most effective way we can prevent the spread of the virus. I can't stress that enough. We all need to do our part to protect our elders, our children under age 12, and those who can't get vaccinated at this time. On that, I'd like to turn it over to Minister Green for some brief remarks. Thank you again.
Thank you, Madam Premier. Good afternoon, everyone. This is obviously a difficult day as we once again face the harsh realities that come with a pandemic like this one. With the latest cases of COVID-19 identified in Behchoko last night, the CPHO has taken decisive action to issue a containment order for the community. This will help reduce the spread of the virus within the community and to other communities. In each outbreak, we follow the same process. We deploy staff and resources to complete testing and contact tracing, and we provide support to those who are isolating. That's what's happening now. We are confirming cases, and we expect the number of cases to increase again today. As discussed at yesterday's briefing, we have already taken steps to relieve the pressure on the system, the healthcare system, where possible, to focus on the COVID response. We are very grateful for the dedication and flexibility of healthcare professionals working across the territory. These people are indispensable, and we owe it to them to do what we can to reduce the spread of this virus. Please do your part in this fight against COVID-19. If you haven't already, get vaccinated. Stay home if you're sick. Follow the orders of the CPHO and encourage your family and friends to do the same. We can get through this together, but we need all NWT residents to step up and do their part. We are here for you. I'd now like to turn the microphone over to Chief Clifford Daniels. Thank you.
Thank you, Minister. This is very interesting times we're dealing with. COVID has hit Behchoko, and by now we're all aware that it has come to our region and our Tlicho communities. Behchoko has recently confirmed a number of new cases and is now under containment order. This is of great concern to all of us, and we must work together to keep all of our residents safe. First thing I ask of you is to stay home. It's very important, and that will keep it from spreading to one another, and that's the safest things we can all do. And wash your hands, wear your masks, keep socially distanced from each other. We're working on getting support for Behchoko community members. There will be food hampers available as soon as we can get them to the supplies in and get them to the people. Tlicho government Northwest Territories, community government of Behchoko, and TCSA are all working together to give community residents the support they need at this very critical time. There are helplines available for the community residents to call if you have any questions. All the phone numbers are on our Facebook page that TCSA has set up a Tlicho language support line that will be available between the hours of 1 to 4. Please do not travel unless it is absolutely essential or necessary. We do not want to bring more risk to Behchoko or be part of the spreading COVID-19 to others. The most important thing you can do to keep our community safe is to get vaccinated. Clinics are available to get the vaccines in Behchoko. Nothing is more effective to get rid of this virus. Together is how we will get through this, as some other communities have. And I'd like to just share some of these comments in Tlicho. Si tadasi go tahongusi na go tlago zagohi. Izo osi nizi de kati do hati letso atile de kwakwe. Izo osi jiza hanizu kesi naiko naita ze diasi ze kesi honta wala da honte ku zuni zade honta wahati si honte. Izo ame honta hi yani ka asun zikitso fwai da gintene suni. So kasi giu get flu yang Hyundai hlezo ji de sen yi gana diule e se sagi deso yi si a de dionde e ya ni to kesi di tadago ta hon wusi e da lo zo go dao go zne da ho zo go dao go zne hani ho na he good ne zia de e yi zon ta de ke ze diaga go unlani e na disi vaccine de disi ame gulesi wo kude ne zia honte hani de tadaha tlo go taho ya le izon ta ko ke diala ni honte no tsiya ti si we daddy honta sa ya je ti to ya yin si ya je ti tin tadasi si de o go wata go he go tsi di si de hani ho na di si go tli si wa si na e good ne zia je mo honte it's on the cat, I see Sunday silly to hearty. It's on husband let's a GD, let a deal with heads down there. He had twice in Mossy. Thank you.
Thank you, Chief Daniels. With that, I would now like to open it to questions from the media. What I will do, I will circle through each media outlet one by one. I'll give you one question, and I think we'll give one question for now, and we'll, with the aim of going through twice through the media outlets, but just in the interest of time, we'll start with one question per outlet. So I'm going to begin by asking Cabin Radio. Do you have a question from Cabin Radio? If you, maybe I'll come back to Cabin Radio. Just a reminder, if you have a question, please unmute yourself before asking your question. And if you can't, if you don't have a microphone, you can type your question into the chat for me. I'll move on. I'll come back to Cabin Radio. I'll move on to CKLB. CKLB, do you have a question? Don't see.
Hello, sorry, can you hear me now?
I can, yes, go ahead.
Fantastic, thank you so much. Did we get an update as to where the transmission had originally came from? Any updates on that?
I will start with Minister Green and see if you have any information on that, Minister Green.
Yeah, thanks for the question. Unfortunately, I don't know where it came from.
Okay. Do we have a follow-up?
Maria, I think we're just going to, or Mariah, I'm sorry if I said that wrong. We're just going to go through everyone just once for now, and then we'll try to come back around, okay? Emily had a question from Cabin Radio. I believe she was the first person there that I had asked. Her question is for Chief Daniels. Mentioned that some supports for Behchoko. I'm interested in if the territorial government will be providing additional supports as well for Behchoko. So I would suggest perhaps Minister Green may have some information there as well as Premier Cochrane, but I'll start with Minister Green.
Yeah, thank you for that question. At this time, we have 6 staff working on the outbreak in Behchoko. They're doing a variety of tasks, including contact tracing and testing. There is off-site testing that is in the rec center, I believe, and it's today and tomorrow from 10 till 4. And there's direction about who should present for testing. If you've been contacted by public health, if you have been out of the territory, or if you're feeling symptoms of COVID-19, you should go and get tested. There is as well 1 Canadian Red Cross nurse and 1 Canadian Red Cross doctor working in the community, and a nurse who has been redeployed from the Beaufort Delta to bring them up to strength. And it's our understanding from the TCSA that they have what they need from the territorial government to deal with the outbreak as it exists right now. Thank you.
Thank you, Minister Green. Next, we'll go to Radio Canada. I believe we have someone here from Radio Canada. Do you have a question? Not hearing anything. Okay, we'll try to come back. Next, we'll go to Northern News Services. Do you have a question, somebody from Northern News? Eric, I see your mic lighting up.
Hey, yeah, I just was wondering, we've been quite fortunate up here in the Beaufort Delta to not be caught up in this current outbreak. There's just been a few flights that have been cited as potential infection spreads in a couple sites in town, but that's all been about last month. I'm just wondering what kind of precautions are being put in place to ensure that the virus doesn't get up here while all this is going on.
what type of precautions are being put in place to ensure the virus doesn't get up there? Okay, perhaps Premier Cochrane would like to address this question. Minister Green may have something to say as well here, but I believe there have been certain restrictions.
Thank you for the question. So basically, anyone who travels has an obligation to file a social isolation plan and identify where they'll be staying, where they'll be isolating, how they're isolating, who's isolating with them. That's our first line of defense, making sure that people identify that. However, it was a lot easier if we could trace every single one of these cases back to travel. The reality is we can't at this point. So that's why we are telling everyone to please use caution, wear a mask indoors, keep your distance, and if you're feeling sick, stay home and get tested. Those are the precautions that we're recommending to every resident in the NWT. First of all, it hit our smaller communities, and now it's hitting Behchoko again and Yellowknife, and so no community every community is vulnerable to this. And again, the vaccination is the biggest thing. So even though the Delta region has been safe so far, it doesn't mean there's any guarantees. So every person has a responsibility to follow the CPHO orders as much as possible and recommendations. Thank you.
Thank you, Premier Cochrane. Next, I'm going to go to My True North FM. Do you have a question, My True North FM?
Yep. Hello. Can you hear me?
Yes, I can. Go ahead.
Yeah, about a couple of weeks ago, there was a field epidemiologist that was in the territory, and they said there were going to be about 9 nurses that were coming to the territory. Are any of them going to be sent to Behchoko?
Minister Green, would you like to respond to that?
Yeah, we currently have 12 nurses and 2 MDs here from the Canadian Red Cross. They are switching people in and out so that they can make sure that people don't become exhausted. So I can't tell you whether the same 9 people are here that were here 2 weeks ago, probably not, but we do have 14 in total, and 2 of them are working in Behchoko. Thank you.
Thank you, Minister Green. Next, I'm going to go to CBC. CBC, do you have someone with a question? I believe they are on the phone. We cannot hear you, Sydney? Okay, I will come back around to CBC. I'm going to go next to Inuvik Drum. Or was that Eric? Was that you already?
That was me, but
okay. I'm not going to give you another
hog the
crack
spotlight.
I'm going to go back up, and I'm going to go back to Mariah from CKLB. Mariah, do you have a question? Another question?
Hi, thank you. Yes. I was curious if we had an updated number, a more concrete one, as to how many households are affected in the community with this recent outbreak.
Thank you. I'm not sure if Minister Green or Chief Daniels may have an answer to that question.
Thank you for the question. I do not have a breakdown by household, how many households. So I'll turn that over to Chief Daniels.
Yeah, I'm not also aware of the number of households, the 12 individuals. So we're not really sure if they're from similar households, from different households. So we haven't had that information shared yet.
Thank you, Chief Daniels. We do have Rebecca Nash here from the Tlicho Community Services Agency as well. Rebecca, I'm just going to see if potentially you have any more information to add.
Yeah, at this point, we are still working through the contact tracing process, so I don't have a breakdown by household. It's just the number of positive individuals at this point.
Thank you.
Thank you.
Okay, I'm going to come back with the written question from Sydney from CBC. Her question is, what is, and this will be probably for Minister Green, What is the ICU situation in the NWT right now, and how many beds are available? Is Alberta prepared to take a possible influx of NWT patients if necessary?
Thanks for the question. The ICU capacity is 6. The number of beds occupied is variable. People get better and move out to other levels of care, or they come in. So it's hard to say at any given point in time for someone who's as far removed from operations as I am exactly how many beds are occupied. Alberta has us as their catchment area, so that means that residents of the NWT are treated the same as Albertans in terms of triage for specialty care, which is what we depend on Alberta for. And so they have assured us as recently as yesterday that the agreement that is very long-standing is still in place. And if we have people with acute needs, they will continue to assist us. Thank you.
Thank you, Minister Green. Next, I'm going to come back to Cabin Radio. Cabin Radio, do you have another question?
Hi, can you hear me?
I can.
Okay, good. Yeah, my question, I know that at various health centers and hospitals across the territory, the level of service has been reduced. What is the status of the level of service at the health center in Behchoko?
Thank you, Emily. This may be a question for either Minister Green or for Rebecca. I'm not sure if either one of you wants to jump in on that question.
I'm going to ask Rebecca if she can answer that. Thank you.
Thanks for the question. At this time, we do remain on emergency services, given our level of community health nurses and those who are able to respond to the emergency and on-call situation. We are doing our best working with the nurses that have been redeployed to still continue and offer services for other non-COVID related matters, but we are still at that emergency services level.
Thanks, Rebecca. I'm going to come back and see if I have anyone from Radio Canada on the line that would like to ask a question. I skipped you earlier, but I'm not hearing anyone. So I'm going to continue on, and I'm going to go back to Northern News Services. Eric, do you have another question?
Do you guys have a contingency plan if the situation in Behchoko gets any worse? As far as previously the forces were brought in for an outbreak earlier in the summer. I'm wondering if there will be some similar plans are in place.
Thanks, Eric. We also have with us Mr. Shane Thompson, Minister of Municipal and Community Affairs, which is responsible for the EMO office. So Minister Thompson, perhaps you want to address that question?
Thank you very much for the question. EMO has asked JTFN to conduct a staff check on rangers availability in Yellowknife, Dettah, Tlicho, Behchoko, Gamity, and Wati, and Wekwiti as a preparedness measure. For clarity, we have not had any requests to date. This is just a precautionary exercise at this time. Thank you.
Thank you, Minister Thompson.
I'd just like to add that community government's also prepared to take an influx of, should there be more cases, just to have the areas in the gymnasium or the arena available to the community should there be an increase in cases. We'll see.
Thank you, Chief Daniels.
And Ali, if I can add as well, the COVID Secretariat will be sending in 3 enforcement officers into Behchoko to assist with any enforcement that the EMO needs. And we're also going to be providing 6 months of PPE to the community to help them along. Thank you.
Thank you, Premier Cochrane. Next, I'm going to come back to True North FM. Do you have a question?
Yep, hello. So of the 14 nurses you said that were in the territory, you said that 2 of them were in Behchoko. Just want to know where the other ones in the territory located. And now that the SHA-2 outbreak is kind of done there and there's more in Yellowknife and Behchoko, are there going to be more that are kind of pushed to Behchoko? Thank you.
Thank you very much. I believe that Minister Green may have some information there.
Yeah, thank you for the question. I'll have to get back to you with that detail. I don't have a breakdown of where the 14 staff are, the 2 nurses, the 2 doctors and the 12 nurses. So that's something I can obtain and Cabinet Comms will get back to you with.
Thank you, Minister Green. Next, I'm going to go back to CBC. Sydney, I believe. Oh, right, Sydney is in the chat. And Sydney's question is, has the current wave in the NWT affected vaccine uptake? If yes, what trends are you seeing there? i.e., who is getting vaccinated now that was hesitant before? Minister Green, would you like to address that question?
Yeah, thank you for the question. We are seeing some increase, and all the numbers in detail are on the GNWT COVID-19 dashboard. We are seeing some increase in uptake as a result of the outbreak. It's very difficult to say exactly why people are being vaccinated now, whether it's now convenient or they're now scared or they're now in town. I don't really, I can't really say specifically to the motivation. We did see, for example, in Colville Lake, the vaccination rate go up substantially after the outbreak there. So, that does seem to be a motivating factor. And of course we encourage that. The thing about being vaccinated is that while you may still get COVID, you will not get as sick. You are not likely to need hospitalization or special care. You'll experience flu-like symptoms only. So we are encouraging people to get vaccinated for their own sake and for the sake of their families and communities. Thank you.
Thank you, Minister. I'm going to endeavor to make one more round to give everyone one more question in the remaining 10 minutes that we have here. So I'm going to come back up to the top with CKLB. Mariah, do you have one more question? Mariah?
No, I'm okay for now. Thank you so much, everyone. Thank you.
Thank you. Okay, back to Cabin Radio. Do you have another question, Emily?
Hi, yes.
Go ahead.
Sorry about that. I think that covered all of my questions as well. Thank you.
Okay, perfect. News North, Eric, do you have another question?
Nope, I'm good.
You're good. All right. My True North FM, any more questions for you? If you are speaking, I can't hear you. Okay, I'm going to move on. CBC, do you have any further questions? Sydney? Not seeing anything. I haven't heard anything from Radio Canada, so I believe we've covered everyone. All right. So without any further questions to address, I would like to thank our participants very much for joining us this afternoon on short notice. We certainly wish the residents and community members of Behchoko well. Thank you all again to members of media for joining us today. If you do have follow-up questions, please.
There's one more question, Ellie.
Oh, I'm sorry, I didn't see it.
In the chat room.
In the chat room. Oh, I apologize for that. Sydney, yeah, CBC has one more question. Are there any other plans to update the vaccine passport system here? Will you do a QR code? Okay, I believe that question is for Premier Cochrane.
Yeah, thank you, Ellie. At this point, we're watching the federal government very closely. I know that the federal government is going to be implementing a vaccine passport to do international travel. There's a number of issues with that with us. For one, we have a huge reliance on travel, airline travel within our communities because of the lack of road infrastructure, all season roads. So we are concerned about things such as medical travel. So we're working closely with the federal government on that and how it will be implemented so that people can still access services and get to communities. The other issue that we have is the resources to do this. Being pretty vocal at the table with the Prime Minister and premiers across the country that we're a small jurisdiction and our resources are thin. So if they're going to be looking at a vaccine passport, then we would ideally work together as a nation across Canada to be able to do that versus one-on-one. It would make things a lot easier and a lot more more effective and more efficient for taxpayers across Canada. So we're working with the federal government, and at this point, we haven't implemented it, but I think that will be a wave of the future. We're not looking at, I don't believe the CPH officer or the executive at this point is looking at using a passport to get into movie theaters, etc. But again, things are very fluid. And so it's all dependent on the services we provide and the residents doing their part. Everyone doing their part will be able to get through this. Thank you, Ali.
Thank you, Premier Cochrane. And on that note, again, thank you everyone for joining us today. If you have further follow-up questions, please address them to the Press Secretary's office or certainly directly to the COVID Secretariat as well. Thanks again and enjoy the rest of your day, everyone.